Surgeons may be incentivized to underplay risks in order to close cases. The average age of someone getting a facelift is decreasing. Patients now come in quoting influencers and viral terms without really understanding the true surgical complexity. Clinics in places like Turkey, Mexico, Brazil, and Thailand are marketing globally via social media. And revision work is lucrative, creating a cycle that doesn't always prioritize the patient. A facelift or rhytidectomy essentially repositions deeper tissues and removes excess skin. The most common complication of a facelift is a hematoma, or essentially a collection of blood, and it's more common in men and when the procedures are longer. Another major risk of facelift surgery is nerve injury, specifically injury to the facial nerve. Meticulous technique is essential, especially around the marginal mandibular nerve, especially as it crosses over the facial artery. This nerve, if injured, can affect the lower lip depressor functions, and that could lead to asymmetry while smiling or talking. It can lead to drooping of the lower lip on one side. Another known risk of facelift surgery is skin necrosis. So if a patient smokes, they're at a 12 times higher risk of developing this type of complication. Necrosis can delay healing, increase scarring, and require local flap repair. Now let's talk about infection risk. This risk is more common with longer surgeries and concurrent surgeries, while superficial cellulitis can sometimes be managed with oral antibiotics. Deeper infections can require drainage, and sometimes people need to be admitted to the hospital for IV antibiotics. Now let's talk about hair loss after facelift surgery. And this, I think, is one of the most under-discussed complications. Improper flap design can elevate or eliminate their sideburn area completely, and that could create an unnatural surgical look. Scars placed along the hairline can interrupt natural hairline density and contour. There are also lifestyle factors that may increase your risk of complications from a facelift. These include smoking, alcohol, poorly controlled hypertension. Patients should be supplied with pre-op and post-op risk reduction strategies that will get them through surgery and the recovery period as safely as possible. When patients start getting facelifts at younger ages, it means more lifetime surgical procedures, which inherently will increase the risk and the possibility of complications occurring. Data shows that facelifts are safe in skilled hands, but complications still occur even in the best of hands.